Just want to share with you what I have learned for the last few years as we're building a robot for biologists. Especially we're a really crazy people. We want to open source everything we build, which is unheard of in biologists. For those of you who have not done biology for many years, and this is what I used to do using this little device, transferring small amount of volume of liquids, DNA, blood from A to B all day. I've done it for 10 years. I'm very good on my right hand. My left hand is getting there. And I quit. So really it's a shame that our cancer research, our crops, and all these other things really relying on a device like that. You kind of say, we can have better too, of course, if you want to pay. So I'm going to share with you what my lessons have learned for the last few years. But I want to go forward a little bit why we choose the open source, and starting from my crazy career. So my career is long, as you know. I'm old. So I started making optics. This diffraction grating at that time, there's only like 3 or 4 people in the world making that device. The company is very profitable, French-based. But you come back to is, how can you keep it so profitable? It's very simple. By patents, by trade secret. So no one know what you did. That is the game long time ago. In fact, it still holds true today, right? And along the way, I changed my career. I make something really big as this room, half of this room. It's an XML laser for micro nozzle. This tool is $10 million, and we sell a lot of them. It's the same trade. You use patents and also trade secret to keep people away. That's how you make money. A lot of money, by the way, right? And in the late 90s, I start thinking about career change. I want to learn something new. I'm one of those people who just can't keep a job for a long time, by the way. I want to learn something new every few years. That's what I do. And I find a small startup in Jersey. We do biologies, which I know zero. And I learned, by the way, and I learned PCR, I learned multiplex PCR, which is really state-of-the-art at that time. Rather than amplifying 1 gene, you amplify 13 genes at the same time. It was fascinating. I really in love with it. Except I find out rather than using trade secret and patents, let me go to the patents for a minute. So that rule in biology, even worse than other technology, is you file so many patents that is insane. You make sure that no one get into you, and if they get into you, it's very simple. I'm going to sue you. In fact, the biotech is famous for there's only one player, and there's no one else. I'm going to sue you in court. That's it. And by the time we sold the company, we have 75 PCT. For those of you who don't understand PCT, PCT is worldwide patent. Our patent fee just for maintenance is $500,000. Imagine the filing, right? And the reason to sell that, to make this, is so no one can compete with you, 100%. Well, but guess what? That's not enough, by the way. And I learned in order to get someone really out of your line so you can charge a lot more money, much more money, you actually have to go to FDA. And he's the ultimate gatekeeper on this business. So you can charge something is cost you $1 to $100. You go to FDA and get the license basically to rip off people. And this is what I learned in my career. From trade secret to patent to FDA, which is a great trade, by the way. You can actually build a billion-dollar company like that, which I don't like, by the way. So that was the time I started thinking about my own career. And that's the time I have a lot of death in my family. I start thinking about what can we do to advance life science? Can we make a better drug? Can we help each other? And I, at the end of that journey, I start using this kind of robot. It's called liquid handling robot. It's very simple, as you can see, actually. But they only charge a small amount called, this $100,000 plus. And by the way, you need to buy 2 because they constantly break down, which I never heard about until I buy 10 of them. Because 5 of them only works 50% of the time. And I say, wait, this is insane, right? So I left the firm. I have 2 of this in my basement, by the way, which I can't fix because it costs $10,000 to replace a motherboard, which I can't afford. So I start rigging things up for my startup. So what did oh, by the way, I'll go back a little bit, so some of you might not familiar with open source biology. What's called open source biology is in the late 90s, early 2000s, people start using their own method to building tools for biology. It's really low cost and open source. The first one is this little thing here. It's called Jumbofuge. As you can imagine, it's a little 3D printer part. You put a couple of tubes on it, which, by the way, you use it every day in blood banking. You mix a blood, you match your A, your B, or O, that kind of type. Rather than using a centrifuge, which costs about $1,000, the guy used a Dremel tool, print a 3D print, costs $0. This is genius, right? I love it. So since that time, I start involved in this community. And later on, they built PCR, which is the most famous open source project within the community. They built this PCR machine for $300 rather than $3,000, and they really cracked the market out. And you can see this machine now in Africa, in all around the world. And by the way, it still works. It's amazing. I seen one very recently out in nowhere. I was shocked. It still works. The guy basically plug it in, it's still working. It's fascinating, right? So I come back to my own journey, and some of you might recognize this. It's called a CNC machine. So when I start building my own company, I need a robot. I take really, as cheap, as low cost as you can afford. I bring one of this, I build my own first robot, which is on the right. It's called the OT1. We're not very genius on name. And at that time, we really thinking about how can we make science go forward. It's clear, if the robot itself is $100,000, I guess 90% of the people cannot afford. But if it's $2,000 or a few $1,000s, people can start using it. But that was not the only reason we built a company. I met my co-founder on a website called DIY Bio, and he and I click off. He's my first customer. He's as crazy as I am. And he proposed something that was absolutely changing my life and his life. He said, why can't we just, build a cheap robot and let people share what they do every day, which is really the key of OpenTrons. What do you call sharing? So imagine this process of doing A to B, right? We call it recipe. It's very similar to you working in your kitchen. Today, you want to make, a pizza. I like 4 cheese. So it's not a whole lot of difference, right? You put the dough, you put the 4 cheese, you bake it inside, right? The process is very similar, just different cheese, right? So that's called recipe, or protocol we call it. So why can't we have a cheap robot and everybody start sharing what they do every day in their lab? And I thought that's genius. We just in love, kind of, and we built a company. And when we incubate in this little space called Gen Space in Brooklyn, in a sub-basement, I call sub-basements because it's worse than basement. No heat, no window, no air conditioning. It's a small bathroom. That's it. And really the goal of building a company at this time and as of today still is we want to advance science by working together. In particular, life science. So I want to share with you what I have learned, we have learned for the last few years. It's very hard. It's just very hard. By now we sell a lot of robots worldwide. Last time I checked, we sell up to 45 countries. In fact, we have robots in a boat down to the bottom of the South Pole. 2 of them, doing sequencing on the boat. What we have found out is very, very few people want to share. As of today, probably less than 100. And worst of all is the industry. All the pharma, all the biotech just say nay. In fact, we have been accused by people in biotech or pharma business is when we offer free service for them, they want to make sure that their name shall never mention, ever. In fact, one of the guys basically threatened me, you will ever mention it, our lawyers on your footstep, kind of like that, They just say, no, you will never mention my name. I say, okay, by the way, you're doing something not really genius, by the way, It's almost like, I have a 4 cheese pizza cooking recipe, you shall not share. Okay. But the good news is there's quite a bit of academic people They really want to share, which is very encouraging. In fact, the higher the stature of the institutional, the more they're willing to share. In fact, they go so far, they're pushing anybody associated with them work together, which is really encouraging part, which is fascinating. And of course, most of all is people in hacker like me. I want to share everything we do. We put a big GitHub site, people can share things, put the code on it so we can work together. I think fundamentally speaking, if I come back and look through the industry part, most of people have this IP in their head. In fact, we ran into that a few times, that some professor, the name should not be disclosed, big guys, you know, everything they want to talk about is we need to sign an NDA and all this thing up front. Say, look, we don't know your secret, we don't care about your secret, let's just have an honest discussion. No, that's not how they work. Right? But I think this is a culture. So my learning experience is it's very hard. It's nothing new, right? But you know, I come back to, is it a future? Is this more I'm interested in it? You know, imagine 10 years from now, and this is my dream, by the way. You know, all of us can walk down to any clinics, draw a tube of blood out of us, and the guy can tell you, you might have a stage 3 or stage 2, our tube of blood. That would be fascinating. By the way, that technology actually exists today, but it's very expensive. Most of us cannot afford. So I'm coming back to maybe there's a way we can make it go forward. Is, you know, make it more affordable. We make more tools so people easier to share. And I think that actually helps people. Because the easier, like, you know, you take a picture today, you know, you just click it, you upload it to Trick to Facebook, and people get used to it. And I think it's more like, how do we encourage the community to work together? It's not like, you know, we're going to destroy the patent. It's not going to happen. But is there any way we can improve the process so everybody can be more willing to share? And lastly, you know, maybe there's incentives to share. You know, maybe we encourage people, look, if you open your IP to the community advance you. You know, there are very encouraging projects outside, like the open insulin project in Berkeley. You know, that's something you guys really interested in, you should check it out. It's something that it takes a long time to do, but I think it's something that, you know, as human, we should all work together to advance our life science. Thank you.
Chiu, thank you so much. First question for me. So on letter D here, incentives to share.
Yeah.
What are some other ideas around how you do incentivize folks to share, like open source biology, especially when you have that IP concern? Are there, is there gamification? Is there, you know, other ways that you can incentivize that sharing? Especially,
I think that's an excellent question. Let's say you're a small biotech, which I ran to someone the other day. So the most expensive drug treatment, therapeutic treatment as of last year was a T-cell treatment in UPenn, which I'm deeply aware because my daughter's best friend died because of that leukemia. And that treatment cost $453,000. Not a whole lot of people can do that, but it exists, right? So Novartis is the one, which I definitely think they pump probably like $500 million to do that project. And can they say, I open it for everybody? Probably not, right? But I think for other projects, like especially insulin, the patent is long gone, right? And in fact, all the, from Warren to everybody start hammering that, right? That's something I think as a community, we should have the power to force the, especially, we're not in the Netherlands, we're not in Lily's backyard, right? We should force them to drop their price to 100-fold because the patent is over. What is them making out of it, out of the patent, out of suffering? And if you check people that I know, a lot of people are on insulin, the price actually have been rising every year, right? So I think the incentive is either we as a community force it, or basically tell the company, you know, we're going to build ourselves, which is not easy. But I think for us, we should do it ourselves. Yeah.
Awesome. Thank you. And raise your hand if you have, oh, awesome. Question back here.
So within open source itself, there are still licenses that differ from place to place. Do you have a plan for that, or are you trying to orient it towards one? Because, for example, in software, we have Creative Commons, we have MIT, we have all sorts of them, and then you now even have Open Core.
Can you speak up? I can.
All right. So, what's your plan for licensing? Are you targeting one single license, or you are accommodating multiple? Because in other fields, open source still has multiple licensing options.
Yeah. So I think for the open source licensing is actually, as of today, very confusing. Absolutely a nightmare. In fact, if you ask 2 lawyers, they'll give you 3 solutions, which I never figure out why. I think as a company, our principle is very simple. We put it up on the web, and we put a lot of effort on documentation and validate what we said is true. So we hold ourselves pretty tight on that. So I can't get into detail on which license is right, honestly, because it's not beyond my pay grade. But I think in general, the open source license is actually workable, unless you get into a very detailed, like particular gene and that sort, which I think is still open source licensing is still fairly reasonable. Yeah.
Awesome. You got one up front?
Yeah. Oh, hi. Thanks. Interesting talk. I like your idea of making this open source so you can share tools.
Thank you.
But the question I have is, the pharmaceutical industry is successful because they develop drugs for certain diseases. They target the disease, right?
I agree.
So in your thinking, what disease are you looking for? Like, what are you trying to promote your tool to solve?
Yeah.
Right?
I definitely agree. I think it's probably very tunnel vision to say all disease. Right, I totally agree. Like the T cell, honestly, at $453,000, I would pay for it. I have to sell my kidney, my heart. Well, I want. You can't sell that, right? But I'm saying, in a certain extent, I would do that. But so certain drug, I definitely think is criminal, especially insulin. The patent is long gone. One of the things I kind of make it a crazy habit. I'm the only one to make that habit. I love reading patents. I don't know why. My wife would look at me and say, every Sunday night after dinner, I'll start on my Google patent drive, I start reading patents. And I would be eating my popcorn, drinking my wine. And she said, "You're crazy." I said, "Yeah, I'm pretty crazy." But on the other hand, I love reading it because sometimes is for instance, give you an example. When Merck first filed the HPV patent, they didn't file the first patent on HPV. They filed the first companion diagnostic on HPV. So I know when they filed the companion diagnostic, the reason there's only one. They're ready to file the vaccine, right? So I kind of know ahead, and I see how they go their strategy. So I think for the disease space, I agree with you, it's very difficult. But I'm more attacking to those who expire, and implication is huge, especially insulin. There's more drug that we think actually expire, by the way. I can give you a whole list of it.
Awesome. Thanks.
Thank you for the much needed idealism. I wanted to ask a question around your talent supply.
Okay.
You're focused on educators and scientists to use your tool. The existing for-profit models make sure that talent supply is captured quite early in the funnel.
Correct.
So how are you actually going to acquire talent to build on these tools and share that code?
Yeah, you're definitely right. It's good news is we're in New York. New York is very diverse space. You can see it. With a lot of people that kind of like me, really want to crack the life science. We actually hire people. Dropbox basically offer them 2 times more money. They come to us because they see we have a vision. And I think that's the talent that we want. We want people to say, okay, I'm no longer just interested in making money, which is important, right? But I want to change the world. The slogan for us is, hopefully, we can all work together to change the world differently.
Awesome. We got one more last one right here.
Thank you very much. You're open sourcing protocols and promoting sharing of that. What about your own hardware, firmware, software?
So on the software, it's all open source, by the way, the whole deck. But hardware, when we build the second generation, it becomes much harder because as maybe you can see it, the complexity I always joke around the robot which built in my basement. It's a basement quality. We're kind of building a nice Honda. It's very hard to open source it. The drawing is substantial. And that's why we stopped sharing the hardware. But if you today ask us about the drawing, we will help you. In fact, we always tell people, there's a lot of people actually, in fact, I think most of my competitor bought a couple of this, take it apart, and they joke around. This is what you got. I say, yeah, it's very simple. Yeah. Thank you.
Chiu, thank you so much. Appreciate your time.